Good day, ladies and gentlemen. Thank you for standing by, and welcome to today's presentation, Clarifying the Confusion Around HIPAA Security. The path to being HIPAA compliant requires a strategy, not just an app. I would now like to turn the conference over to your host for today, Leanne Myers, Chief Clinical Officer at PerfectServe. Leanne, please go ahead.
Good afternoon. Nathan, thanks for the run-through on the housekeeping items. As Nathan said, I'm Leanne Myers, and I'm the Chief Clinical Officer here at PerfectServe. I will be serving as your moderator today, and we would really like to thank you for joining today's webinar that will discuss conducting a HIPAA risk analysis. First, I'd like to introduce our speakers for today. Bob Chaput is the CEO and founder of Clearwater Compliance. Having served in operational and technology executive assignments in large healthcare enterprises, Mr. Chaput is no stranger to protecting large amounts of highly sensitive HR, benefits, and healthcare data. His experience includes responsibility for some of the world's largest healthcare databases requiring the highest levels of security and privacy. While a senior executive at GE, Johnson & Johnson, and Healthways, Inc., his 30-year career includes 25 years of responsibility in regulated industries, with 20 of those spanning the high-security, privacy regulated healthcare industry. Along with Bob today, we have Don Daly. Don is the Chief Technical Officer at PerfectServe. PerfectServe's clinical communications platform is used by leading U.S. health systems to improve patient outcomes and operational efficiency, all on a secure platform. I would like to take a minute to thank our speakers for giving what I know is going to be a very educational presentation. They will help answer some of the following questions. What are the requirements under the HIPAA security rule? How do I begin developing a risk assessment strategy? And where is PHI currently residing in my organization? Bob will begin by walking us through the steps for conducting a bona fide HIPAA risk assessment, and then Don will wrap up by talking about the different modes of communication that need to be considered and share some data with you that demonstrates where PHI resides in an organization's communications. We will, as Nathan mentioned, hold all questions till the end, but please start to enter them during the presentation in the question and answer feature. At this time, I'd like to turn things over to Bob.
Well, great, and thank you very much for the kind words and introduction, Leanne, and welcome everyone. I really appreciate the opportunity to speak with you today. As you can see in the slide that's in front of you, I've underlined purposely the word bona fide HIPAA security risk analysis because I have a bit of an attitude about that. I feel that there are too many organizations out there that are presenting certain solutions as bona fide risk analysis when indeed they're not. And so as we enter into this session, I have a going-in theme, and that theme is that you cannot possibly do a legitimate, thorough, rigorous risk analysis as required in the HIPAA security rule until or unless you understand the basics of risk. And I will hopefully make a point as we go through the materials to say that a lot of people are confused about what risk comprises. So with that, let me just remind you, if you've not been introduced to Leon Rodriguez before. Leon Rodriguez is an attorney by background and training. He's currently the director of the Office for Civil Rights within the Department of Health and Human Services. As I mentioned, an attorney by training. He comes most recently from a position as the Chief of Staff at the Department of Justice, so he has an enforcement background. He, prior to that, served in private practice as well as in public companies. And along the way in his career, he was a prosecutor in Montgomery County in Maryland, just outside of D.C. All of that to be said because Leon is a prosecutor by training, an enforcement guy by background, and he walks around saying things like the only way to HIPAA compliance is by way of enforcement. And in a relatively recent event, this happens to have been September 23rd, so-called Omnibus Day, someone will recognize it at that, he said what we're seeing over and over and over again is a failure to do a thorough risk analysis. And it'll be one of the areas of focus in 2014 audits. We know from experience, we've worked with over 350 organizations, 20 of whom have gone through either an OCR audit or an investigation. Absolutely, unequivocally, this is one of the areas of focus, and the materials and evidence of having done a risk analysis is there. As he refers to failure to do a thorough one, I'll give you a couple of data points, one of which is that of the 115 organizations that were audited in 2012 as part of the pilot program, 68% of them had adverse findings as it relates to risk analysis. Translate, either A, didn't do it, or B, didn't do it properly. And the other data point is if you look at the organizations who have been through an OCR investigation that resulted in a settlement agreement and a corrective action plan since 2008, and these include organizations such as UCLA, Alaska Department of Health and Social Services, Blue Cross Blue Shield of Tennessee, WellPoint, Affinity Health Plan. Every single one of those organizations was dinged for not having done a proper risk analysis. So the landscape is littered, if you will, with lots of failures in this regard. And I'll go on to say, and exhibiting my attitude a bit, we in health information management are in a big mess as it relates to overall risk analysis and risk management. And I say that for a couple of reasons. First of all, what's unique for some reason, and a little bit inexplicable to me, even among security professionals, if you bring them in a room and ask them about fundamental terms and definitions such as assets, threats, vulnerabilities, controls, likelihood, impact, you will have diverse opinions. It's crazy. On the other hand, if you bring into a room physicists and ask them about velocity, acceleration, mass, energy, there's uniform agreement. Similarly, among finance people, when they discuss risk and liabilities and assets and balance sheet, for some reason, there's huge confusion in our world when it comes to basically understanding risk and risk management. And the other issue is that too many organizations are treating this as some draconian government problem rather than a patient safety issue. The upshot is that we have huge inefficiency and ineffectiveness. And in that particular regard, let me just point to these numbers, for which I have an update, actually. Some of you may recognize these numbers right away. But according to the website that the Health and Human Services Organization maintains, that I've dubbed the Wall of Shame, 720 organizations, along with 167 of their accomplices, business associates, have collectively contributed to the impermissible disclosure of now 27.8 million Americans. By the way, 167 business associates alone have contributed to the impermissible disclosure of 12.9 million of those individuals' records. So it's a big mess. What are we going to do about that? Well, the first thing is we need to recognize that PHI is everywhere. The most fundamental step, the beginning step in any bona fide risk analysis is to complete a rigorous and thorough information asset inventory. You need to map your business processes. You need to understand the flow of protected health information in your business, and you need to know where it lives. I'll give you a simple example. We have the unfortunate circumstance of the people at Affinity Health Plan. These folks are the most recent, I'll say, poster child on the Health and Human Services Wall of Shame. They returned a collection of copiers and scanners and printers to their leasing company for refurbishment and redeployment somewhere else. Little did they realize when they sent them back that the records of 545,000 individuals were stored on hard drives within those machines. Were those devices included in their risk analysis? No. Another example, think about today's modern electronic health record system. It might be Epic, it might be Cerner, it doesn't matter. When you think about that information asset, it's not just the system, it's where does the PHI live. And in fact, more appropriately, there are 4 operative verbs in the HIPAA security rule: create, receive, maintain, and transmit. And fundamentally, when you do your information asset inventory, you need to know the flows between people within your organization, physicians, nurses, and the patients themselves, and outside of your organization. The failure of most people, I'm sorry to say, to do that rigorous first step is what's resulting in downstream bad outcomes in the form of impermissible disclosures. So what we really encourage organizations to think about is, where is this PHI flowing? Where is it created? Where is it received? Where is it maintained? To whom is it transmitted? What are the channels and modes where PHI is moving around your organization? As it relates to any risk analysis, and this is really, for a moment, risk analysis, quite frankly, is agnostic of healthcare, and it's agnostic of HIPAA. It's a foundation of any good information security program. But when you bring it into the healthcare world, the information assets that are of concern are protected health information. And if you think about it from a very personal basis for a moment, and you think about all the good things that are happening with the nationwide health information network and the vision that someday, God forbid, admitted and present myself in an emergency room on the West Coast, someone can go ticky, ticky, ticky on their keyboard, access my full set of longitudinal health records, and deliver better care to me. That's a very exciting vision. And all that the High-Tech Act is providing in the form of stimulus to make that happen is great. However, I have concerns as a patient, and I would encourage you to have the same concerns. What if my PHI is shared? With whom will it be shared? How? Under what circumstances? What are the rules of engagement? What is the governance around that information? This is the dimension or the matter of confidentiality of my PHI. The next set of questions relate to, what if it's changed? What if something is deleted? What if bits move around and my blood type is changed as it's migrating from point A to point B? That could have a literal life or death effect on me. That's the matter of the integrity of my protected health information. And last but not least, in that emergency room situation, what if someone goes ticky, 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 looking up attempting to look up my longitudinal records so they can make more informed decisions about the care they're going to provide to me, and we get the 404, page not found, or system unavailable. That's the matter of availability of my PHI. When it comes to risk analysis, we need to understand where the protected health information lives and what are all the possible things that may happen to compromise the confidentiality, the integrity, or the availability of PHI. That's the exposure. That's where risk or harm can come in. Now, what I want to do is switch completely out of healthcare for a moment and come back to a point that I made at the very beginning, and that is, unfortunately, people are performing risk analyses who don't even know what risk is all about. I'm going to provide a bit of a test, and when we do this live and in person, we have a chance to interact, so we're going to have to do this in a somewhat trusting mode because all of our attendees are in listen-only mode today. I'm going to present 5 images to you, and what I'm going to ask you to think about as I present these images, when you look at them, how much risk do you see? And let's keep it simple. High risk, medium risk, low risk, or no risk. So your answers, as you jot them down on your notepad, are H, M, L, or N. Here's a bald tire. What do you see? High, medium, low, or no risk. The next image I'd like to present, I've taken the bald tire, and I've tied a rope around it, thrown it across the top of a branch, and I've created a tire swing in my backyard. When you look at that image, how much risk do you see? High, medium, low, or no? The next image is one of a piece of frayed rope. Tell me how much risk you see when you look at that. High, medium, low, or no risk. Next, I've taken the tire swing, and I have it in a tree over the raging Rogue River. That's a 200-foot cliff going down into the Rogue where it happens to be the case. We've got a Class 4 rapid going on below us. When you look at that image, how much risk do you see? High, medium, low, or no risk? And then finally, we've taken the tire swing, and we have, I'll say for the sake of discussion, my granddaughter is on the tire swing. When you look at that image, how much risk do you see? Do you see high, medium, or low risk? Well, again, not able to do this quite interactively, let me suggest the following. In these images, I usually will say at this point, when you look at those images, what's the greatest amount of risk that you see? And invariably, someone, at least one person, but typically the entire audience will say, I see high risk. And then I'll ask how many people saw. The maximum amount of risk that you saw was medium, and I'll have a number of people say that. And maximum amount of risk is low, and I'll have a number of people say that. When I ask, is there anyone who saw no risk in these images, I will end up seeing or having no one respond, that there's no risk. In fact, what I end up hearing is that there is risk all over these images. Well, the sad reality is the following. There is no risk in any of these images. The mistake that people make is that they look at images and they make things up. That's just a bald tire. It's not on anyone's car. And that's just a frayed rope. I didn't give you any other information. I didn't connect it back to the tire swing in any way. And then they look at the tire swing hanging over the raging Rogue River and they think, oh my goodness, how much risk is that? Well, in the image that you have in front of you, there's no risk at all. Who cares if an old bald tire goes careening down into the raging Rogue River? No one. The only image in which there is potential risk is the image involving the child, because in no other image is there an asset. Here's a fundamental maxim about risk. Without the possibility of significant risk or harm, there can be no risk. And in these images, there's only one possible place where there might be harm, and it could be to that child, if you'll forgive me and allow me to call children assets for a moment. So this is a fundamental problem. In the world of risk analysis, there are let me back up. There are assets, and what we care about, moving away from tires for a moment, are the assets involving PHI. Think about a laptop. There are, in addition to those laptops, in addition to the assets, a laptop with PHI, there are threats. Threats emanate from four sources. It may be an adversarial threat. It may be the hacker sitting in Belarus or in the Crimea in the Ukraine or sitting in the building in Shanghai, or it may be someone within my building, a disgruntled employee. The second major source of threats are accidental. That keystroke, oops, I didn't mean to send that email, with everyone's email address in the carbon copy line rather than blind carbon copy, indicating the program we're doing for diabetes next week. Or it may be a driver in the lot next to yours who digs up fiber optic cable and affecting the availability of PHI. The third major category of sources of threats are structural. We're all dealing with electromechanical devices here, and they fail. Hardware fails, software supplies go, heating, ventilating, air conditioning fails, and the last source of threats are environmental. Fire, lightning, hurricanes, you name it, earthquakes. So what people don't get is that in order to have risk, there needs to be an asset. There needs to be threats to those assets, like the laptop may be stolen. And shoulder surf behind me, I may not have a privacy screen. Lack of a privacy screen is a vulnerability. In order to have risk, you need to have an asset, you need to have threats, you need to have vulnerabilities. Some of those, but I didn't bring them together. It's only when you have a triple, an asset, a threat, and a vulnerability, that you can possibly have risk. So I want to make an important point here. Before you do a legitimate bona fide risk analysis, you really need to understand the fundamentals of risk. To do that, start to think like a risk analyst. You have security risk if and only if there are threats that may exploit vulnerabilities. A laptop with PHI is the asset. The threat is a burglar. The vulnerability might be lack of encryption. If I have a threat that can and cause adverse impact on my organization, then and only then do I have a risk that needs to be analyzed. But at that point, I've now got a triple asset threat vulnerability that needs to be looked at from two perspectives. What's the probability of a bad thing happening? and then were it to happen, impact. To keep it simple, think of the probability as high, medium, and low. You can think of the impact as high, medium, and low. And in the case of a laptop, what's the possibility of a laptop being lost or stolen in the U.S.? 37,000 go lost or missing every single week. What's the chance of it being stolen, getting it, and accessing PHI? Well, depending on what controls you have in place, may determine what the likelihood of that is. Risk analysis is fundamentally a process of identifying, prioritizing, and estimating risk. If you do a risk analysis properly, the journey, you will feel exhausted. At the end of the journey, you will have a long list, if you've done it properly, of all the risk in your environment. Classically, typically, when we do a risk analysis, we end up finding hundreds of risks. That's the bad news. The good news is they are rank ordered from the least serious among them. So you can then, the whole value of doing a risk analysis is to allow organizations to sit down and have intelligent, informed discussions about their risk treatment program. Don't confuse risk analysis with risk treatment. Important events. Risk analysis is the process of teeing that up. Health and Human Services in July of 2010, because of a fair amount of fear, uncertainty, doubt, misinformation, fear, and the crazy things, published guidance on how to do a bona fide risk analysis. And this was about a 9-page PDF. And in that guidance, they said, look, we don't care whose methodology you use. It might be based on NIST. It might be based on ISO. It might be based on the Carnegie Mellon methodology. It might be based on FAIR. There are several. Risk IT from ISACA. We don't care which one you use as long as it includes these 9 essential elements. And the 9 essential elements, frankly, boil down to the things we spoke of. What are your assets? What are the threats to those assets? What are the vulnerabilities? For every triple, analyze the likelihood of a bad thing happening, compute the, look at the impact, compute a risk value, et cetera, et cetera. However, notwithstanding their comment that we don't care whose methodology you use, we advise organizations to use on NIST. And when you are presented with a slide deck, you'll find these links should be hot. If they're not, you can simply Google these documents. At the very heart of the NIST security framework is Special Publication 800-30, How to Conduct a Legitimate, Thorough, Rigorous. We encourage, because the HIPAA security rule is based in its entirety on NIST, we encourage organizations to use the NIST security framework. If you do a proper, thorough, rigorous risk analysis, certain benefits will accrue to you. Most important, your job. You'll be protecting patient, member, customer, whether you're a covered entity or a business associate, you're taking care of business. And that's what this is all about. It's not about some government regulation. Number 2, you'll be remaining competitive in your environment. We are seeing already not only being on the receiving end of significant fines and penalties, but organizations actually going out of business. An organization called Impairment Resources in Southern California, an organization called Creative Health, barred from doing business in the state of Minnesota, consequence of HIPAA violations. So you'll stay. And by the way, you'll certainly be prepared if you do this properly for an OCR audit or a review by your customers. State attorneys general are now given jurisdiction to file civil suits on behalf of their citizens. This is not only good common sense business, but it's also playing defense. You'll be demonstrating good faith effort as it relates to compliance with the HIPAA security program. With that, I'm going to turn things over at this point to my colleague, Don.
Thank you, Bob, for your insights on conducting a risk analysis and helping clarify some of the confusion that's out there. It's really valuable information. I'm going to begin by giving you a brief introduction to PerfectServe. Then I'll share some of the data we've analyzed as it relates to PHI and communications. So let me begin by answering the question, who is PerfectServe and what do we do? PerfectServe is an intelligent, unified communications platform with a suite of applications designed to connect clinicians across the care continuum. Healthcare providers partner with us to improve outcomes and operational efficiency. We enable this by removing variability from the communication process and speeding contact cycle times between clinicians. This helps them better coordinate care, all in a secure environment. We give our clients the ability to consolidate all PHI transmitted to clinicians in one common, secure platform. There are 4 capabilities that PerfectServe brings to its clients to deliver these results. First, the industry's first and most advanced communications rules engine that was purpose-built to effectively address the complexities inherent in real-world clinical communication processes. Second is a best-in-class services organization to quickly drive communication process improvement and standardization across the health system and sustain those improvements over time. Third, a single cloud-based architecture with voice, web, and mobile applications, as well as data interfaces that make it easy to connect clinicians in every care setting, whether pre-acute, acute, or post-acute. And fourth, a secure infrastructure that allows an organization to establish an effective and comprehensive HIPAA compliance risk mitigation strategy with the analytics necessary to monitor that risk on an ongoing basis. PerfectServes Platform is multimodal and secure. This graphic demonstrates how PerfectServe allows you to consolidate all PHI transmitted to clinicians on a single platform that accommodates all of the contact modes that are typically used. This allows you to establish and effectively implement policies regarding the transmission of PHI to mobile devices. For example, you may determine that it's acceptable to send PHI to messages accessed through a secure mobile app, while that same message, if sent to a pager, would result in PHI being automatically removed. Here at PerfectServe, we recognize that there is no, quote, one-size-fits-all security approach for clinical communications. We designed our platform to be powerful enough to meet the stringent security requirements, yet flexible enough to accommodate your need to establish policies that balance security with patient safety as well as other issues. We currently serve more than 31,000 physicians in over 80 hospitals and 12,000 practices. Working with these clients, we've learned that HIPAA compliance in healthcare extends beyond text messaging. The universe into which text messages and PHI enters is actually much broader. It includes sending messages from mobile carrier sites, web and console-based paging applications, call centers, and more. We analyzed our data, and it highlighted that secure device-to-device texting only addresses half of the problem. The analysis of 60 hospitals demonstrated that these 60 hospitals generate roughly 5.8 million communication cycles per year to roughly 22,000 distinct recipients. This makes completing a thorough risk analysis a challenging undertaking. As Bob discussed earlier, HIPAA compliance isn't about buying and installing a specific technology. It is about assessing the risks to your organization, developing and implementing a strategy to managing those risks, and then monitoring the risks on an ongoing basis. Focusing on text messaging in your assessment means you don't see, and therefore can't mitigate, half of your communications risk. You need to focus on all communications, including phone calls. Let me give you another example that drills down a bit deeper. Consider the following from a study of 3 hospitals. The data in this analysis represents an aggregate of 883 staffed beds and just over 54,000 annual admissions. There are approximately 683,000 communication cycles per year. That's around 774 per hospital bed that were transmitted through a variety of communication modalities. More than 608,000 of the total communication events, that's 89% of the total, consisted of hospital-to-physician communications. 75,000 of the 683,000 events, that's 11% of the total, entailed physician-to-physician contact, of which half were real-time conversations. Let me repeat that. Half of physician-to-physician communications resulted in real-time calls. Because most of these communications contain PHI, they must be considered in your risk management strategy. The organizations in this study have consolidated all physician communications on a common platform, and therefore were able to implement a comprehensive HIPAA compliance risk mitigation strategy. Working with our hospitals, we found that in the course of providing care, clinicians direct a high volume of communications to physicians, and because most of these communications contain PHI, they require an effective HIPAA risk mitigation strategy. We have heard a lot of concern around physician-to-physician texting, but physician-to-physician texting represents only 6% of the total communications volume. We know that physician communications are multimodal, and that means all modes must be secured. Consolidating all physicians' communications on a common platform allows organizations to implement an effective HIPAA risk mitigation strategy and monitor it on an ongoing basis. I will now turn things back over to Leanne for a quick polling question.
Great. Thanks very much, Don and Bob. Before we open it up for question and answer, just a reminder to submit your questions over to the right in the question and answer section. But we thought we'd ask a polling question of you today. Nathan, I see you opened up our poll. And the question is, other than text messages, which of the other communication channels are at the top of your list for evaluating risk? We know that clinicians use a variety of communication channels, and your risk mitigation strategy needs to include all of them. We really hope that the information that Bob and Don shared with you today will give you some of the tools and the resources to do just that. At this time, we'd like to turn it over to questions. We've had several come in during the presentation. I will be asking the questions, and I'll ask the speakers to answer them. Bob, the first question came in for you today.
Okay.
Okay, you're off mute. Very good. And that question is, when listing your assets and where PHI lives, do we need to list others with whom we are interfaced, is the first part of the question. And does that fall under ePHI, which is transmitted?
I would say yes. I would absolutely err on the side of all the PHI, even in those cases, and probably, let me say it differently, especially in those cases where it's going outside of the organization. So be the case that it's a transmission facility to a medical billing company, case that you're receiving information from an insurance company. But in any case where you're either transmitting or receiving, I would definitely identify those as information assets. It might be that when it comes to doing the risk analysis, it's the responsibility for those assets is in the hands of a third party, but you may have certain storage facilities or repositories in your business that require the same scrutiny as they would for any other information asset that you have.
Great. Thanks very much, Bob. Bob, the next question is for you as well. You've mentioned a bona fide HIPAA security risk analysis several times during your presentation, and you spoke about it. So why do you keep emphasizing the word bona fide? Is there something wrong with the way it's being conducted?
Yeah, there's some thing. There are lots of good things that need to happen in an information security program. And oftentimes there are organizations or individuals who, outside third parties, who are representing to their customers that do a vulnerability scan or a penetration test or a social engineering test would constitute a risk analysis. On the other extreme, there are organizations representing that if you fill out a certain questionnaire that asks you certain questions about your policies, that may be sufficient. A bona fide risk analysis must include consideration of all the assets, all the threats to those assets, the vulnerabilities, the likelihood of bad things happening, and were they to happen, the impact. And I would just advise and ask, if you're speaking with people inside or outside of your organization about a risk analysis and they're not using that terminology, that you might just do a double take on that.
Great, thanks. Bob, the next question is for you as well. And it's, healthcare organizations have suffered from a lot of healthcare information theft and loss. What are the challenges that healthcare organizations must address to help turn this tide?
There's not a silver bullet, and it's not a one-dimensional problem. We encourage organizations to act. Scheme of things, the HIPAA security requirements are one matter. Typically, there are other requirements that are organizations, either other regulatory requirements or state or breach. And in 2000, there was one test that had.
Hey, Bob, we have you echoing in and out just a little bit.
Oh, okay. Sorry about that.
That's okay.
How about, is it any better now?
Much better, thank you.
Okay.
Oh.
Okay. Oh, are you still there, Leanne?
We are. We were definitely having an echo problem, though.
All right. It's still occurring?
That's better.
Okay. I'm host, and hopefully we'll overcome that. So, addressing all of this loss and all of the disclosure to be a multidimensional solution to the problem. The problem is about not just HIPAA, it's about meeting state, possibly requirements that organizations need to meet. All that said, and lies in a four-prong approach. Number one, policies that meet the requirements of regulations, and policies that will ensure that you are doing good risk management in your business. Secondarily, there are procedures. Policies are aspirational statements that declare what we're going to do and why we're going to do it. Procedures bring policy to life in the form of details about who and when and by whom, etc., and what and how, etc. And then there are people programs. Once you have good policies, procedures, and processes in place, members of the organization need to be trained. Most organizations suffer from the phenomena of either unwittingly and unintentionally ending up with a collection of workforce members who represent their because they've not been trained. And they end up being liabilities rather than assets. And then last but not least is the matter of reasonable and appropriate safeguards, administrative, physical, and technical. Sadly, often too many times, we see organizations turning it into and all of a sudden it's about some IT control. It's broader than that, and it really gets to those four dimensions. There's people and safeguards.
Great, thanks, Bob. Don, the next question that came in is for you. You mentioned something about removing PHI from messages sent to pagers. Can you elaborate a little more on that?
Sure. So PerfectServe, when we build our messages, we structure the input of those messages so we know what is PHI and what's not. For instance, we know where patient first name and last name and MRN are. And when we generate the message to go to each of the devices, keeping that multimodal picture in mind, we're able to create different versions of the message, one with the PHI and then one with the PHI filtered out.
Great. Thanks very much, Don. Bob, the next question is in for you, and it is the information displayed on hospital white communication boards containing the name of the doctor, nurse, room, patient name, etc., considered a high, medium, or low risk?
That sounds like a trick question of the type I would ask someone. Not a question about risk until I know the assets, the threats, the vulnerabilities, etc. And so, seriously, there'd be more I would want to know about that circumstance. If indeed this information could be connected to past, present, future medical or mental health state, and it was something that could be traced back to the individual, then we're talking about protected health information. And if indeed in the manner in which it is presented in this scenario, if in that manner there is disclosed, then we're disclosing confidential protected health information, and it would represent a risk. As to how to label it, I need to know about more about this circumstance, but there certainly is potential risk. As we understand more about it, it's hard to judge exactly.
Great, thank you very much. Bob, the next question came in is for you as well. And it says, so now what, and what should we be doing to create a culture of patient-member privacy and security?
Yeah, that's a great question. You may or may not be aware the words and phrases coming out of the Office for Civil Rights, things like creating a culture of compliance. Of course, Leon Rodriguez one time used the word, he wants to see the whole enchilada, but let's stick with culture of compliance. What is that all about? We believe that there's a playbook to get there, and we come by it by virtue of it we've had through the audits and investigations and assisting a lot of organizations to become compliant. But I would say, think about 9 steps or 9 plays in your playbook. First and foremost, if you've not set it up, ensure that you have governance oversight in your organization. It's going to mileage the size and the nature of the type of organization. In some organizations, it may take the form of the HIPAA Compliance Committee. In other organizations, it's a part of a broader risk management committee. And in some cases, it's a committee that reports to the board, is part of the board of directors. Number 2, if you have not yet updated all privacy, all security, all breach notification policies and procedures to reflect what's required in the changes driven by Omnibus, I would be on that. Number 3, the policies and procedures in place. I alluded to this a moment ago. Train members of the workforce. Turn them from liabilities into assets. Turn them into sentinels. Deputize everybody in your organization to be a privacy and security official. Next, I would make sure I finished in the security rule, there's a requirement, aside from risk analysis, to do an evaluation. And that breaks into 2 parts, a non-technical evaluation and a technical evaluation. Beyond that, I'd stand up a business associate management program. I think I mentioned these numbers earlier on. Of the 27.8 million Americans represented, sadly, on the Wall of Shame today, 12.9 of them are there because of downstream business associates. It's a huge risk for many organizations. And then last, I would encourage people to really validate and self-audit their compliance vis-a-vis the privacy rule and breach notification rule. If you embark on a journey, and I know in organizations that are trying to care for patients, this is not a top-of-mind issue, but the struggle that we see, patients are exhibiting a switch from this being a necessary evil and some draconian compliance program to move into the mode where it's an operational necessity, and for the most enlightened to move into the mode of it's part of their competitive strategy. They are ability in town as it relates to safeguarding patient information.
Great. Thanks very much, Bob. One more question just came in for Don, and that is, does PerfectServe require specific advice to secure communications?
So the answer is no, and I don't know if we can go back to one of my slides that has, it's like slide 20 maybe. There you go. Right there. The answer is no. We are device agnostic. Now, with that said, some devices will enable more capabilities than others. For instance, smartphones are going to provide the most user-friendly experience. And with that, the ability to receive text messages that have more information in, for instance, PHI, then organizations are comfortable sending to an alphanumeric pager or a cell phone via SMS. So bottom line, a specific device is not required to use PerfectServe. However, for more user-friendly and secure modes, smartphones are usually the best option.
Great. Thanks very much, Don. So as we wrap up today, that seems to be it on the questions. A couple things that I just wanted to point out. I wanted to share with you some additional resources that are available to you on this topic. These include a risk analysis guide, a compendium of HIPAA risk analysis resources, as well as 2 additional white papers. And just flip through those. We did have one other question come in that I want to go ahead and address while I was going through that. And Bob, I'll let you take a pass, or potentially Don, this could go to you. What level of encryption should be used to transmit ePHI, and what level of encryption should be used to store it?
There is guidance. So let me respond in a couple of ways. First of all, the matter of encryption is addressed in 2 areas. One, in cases, it's under the broad umbrella of technical safeguards. Under the standard called access control, if you think data, there's a implementation spec, and under transmission security, there's an implementation spec, as they're called. In both cases, in the security rule, they are labeled as addressable requirements. Don't think addressable means requirements. One is required, the other is addressable. Please do not interpret addressable as meaning optional. It means you either do it or you document why you didn't do it, and you then go on to implement, sometimes referred to as defense in depth, to create an equivalent amount of protection. Okay, so that said, there's not a hard and fast requirement for encryption in the security rule. Along came the breach notification rule, driven by the HITECH Act, or promulgated from the HITECH Act. Breach notification rule does not require encryption. Create a phrase called secured PHI. If PHI is encrypted, it's called secured, and it effectively, under the breach notification rule, creates safe harbor. So that said, it's not just a matter of it being encrypted. It must be encrypted based on guidance provided by Health and Human Services. A couple of weeks ago, we did a webinar on this subject, and so what I prefer to do, rather just cite this from memory, there is guidance that was issued from HHS, and I can provide a document. There are specific NIST actions cover that are appropriate, and furthermore, there's reference to certain FIPS documents, Federal Information Processing Standards, the correct level of encryption. So it's all there, and it will serve your needs in terms of guide according to the breach notification requirement. And if, Leanne, you're able to provide to me that individual's email address, or if you want me to do it through you, I'll separately provide you with a link to all of that information.
Great. Thank you very much. We appreciate that, Bob. And then as we wrap up today, just a couple of other things. Nathan, you can go ahead and open up the final poll. But we will be sending out a recording and the resources of what we discussed today that will be coming out tomorrow. We very, very much appreciate you joining us today for this important topic. We know that there are points that Bob was making that kind of got lost in an echo. We'll make sure that we provide you guys with the commentary. We've been asked by quite a few people to be able to capture that information, so we'll make sure that we send that out to you in the email tomorrow. And again, thank you very much for attending today. We appreciate your time. We know you have very busy schedules, and watch your inboxes tomorrow for a link to the recording and the additional resources. And that wraps us up for today. Have a great day.